like 0 degrees. I'm out the cage, gotta let out the beast. Revolutionary, gotta let out the streets. Locked in the cage, I'ma let out the wake up, get out the sheets. We came from one man, forget that peace. You take the west side, take out the east. I'ma put them in the cage.
Hello, welcome to my channel, Healthy Body by Sophie here. Just zooming here to make sure the camera focuses on what I'm doing. So here, as you can see, we have a Chinup bar. The two little cups on the side are screwed into the door frame, and my husband used some double-sided tape as well, because otherwise it seems to be sliding. But we also figured out that because you unwind the bar to tighten it, to loosen it, and you wind it to extend, to get it to fit inside here nice and snug, I realized that I have to make sure that I am hanging. If I hang in this direction facing, it's always gonna make the bar slide this way, and as a result it will always keep it in a tightened position. We figured out the other day when I asked when it's not working. Well, he was smart to realize, especially since he installed it, that if you go this way, eventually it will loosen up. Even though I did use the double-sided tape inside, that does help. You can add that as an extra measure. But if you wonder why it does loosen up, not that it's gonna come off, it's just then as you hang, as I'm gonna show you a few exercises in a moment, it's not gonna stay where you're starting. Your hands are gonna start sliding down a bit. It's not the hands are sliding off the bar, unless you have lotion and oil. I just washed my hands, by the way, to remove any oil excess. But what's happening is the bars slide a bit, so as a result your hands are not in this upper motion. It ends up being more here. This is something, Wayne, as you can see, he has his own bar that's up here. This one is a bit too tall for me to reach. I can't even with the tip of my toes. But this one is actually just high enough for him to fit underneath without hitting his head, so which is good. Anyone taller than 5'10" would not fit, or 6 foot for sure. So this is my bar, and so I was doing it on this side often, and I'm going to do it this way to show you. But when I actually work, I usually go this way if I'm gonna be this direction, because I realize that's gonna keep the longevity of this bar so that it doesn't start rolling. But for the purpose of today, I'll go here. So basically, so ever since I've been doing this, like on pretty much daily, I'm not doing as much as Wayne because he's here so much longer, even when we're not working with our patients, that every time he walks by, he just grabs the bar and he hangs on it. And so there's not that many things we've done here. There's a lot you can do. You can do chin-ups, of course. I'm gonna do a little demo, see how many I can do. I've not done it in a while. But here, one that's really easy. At first, it was hurting, and it still hurts, not as much now, because I've combined a few different methods and therapy. Some that are my own, and some that I am including a little bit more advanced thing, just to give me a variety. So here, basically, I'm just hanging on the bar. I have my feet bent, and my knees bent, as you can see. So you can be bare feet, just make sure that you're not slipping in here. So here basically you hang as much as you can. So at first, if one of your shoulder is hurting, you might only be here, right? And that's all you can do. But then you whatever you feel your body it's enough to give you a little bit of resistance and challenge. Whatever your challenge is at one time, that's what you work with. So you could have your feet more just below, perpendicular to the bar, and then you kind of hang. I would start here at first. It would be easier, safer if you do have lots of issues with your shoulders, or even if you don't, it's still okay. But definitely if you do have issues, and then you're gonna let your body hang as much down as possible, relaxing your shoulders. If it is a little bit too, you can be not so much your arms up here, you can have them spaced apart. So you could have all kinds of things coming where, you know, it feels tight in here, it feels tight on me, but actually this has been helping to stretch all of the fascia in here, the tendon, just to give it a good nice stretch, because we tend to be in this position too much. I don't so much anymore, but I catch so many of my patients on the table, or as I watch their stance walking, and hands go like this as soon as we don't use our hands to grab something or to do specific movement that's opening. We have to, as much as possible, keep our arms and hands open and opening the chest out to the side. Now I can go a lot lower, as you can see. I can even let my body hang, which I have not done that one, but as you can see, I'm okay right now from my throat and shoulder back in February. And I think I think that the training that I've been doing as well with Master Chino, working on some tools. So we're using a tool that's called a mace, a steel mace, and the reason I chose to use it, I've been doing martial art, as in Tai Chi anyway. So here, be careful. You know, here I feel a little catchy, but I know things are loosening up, and I know my shoulder now. If I put my arm to the side, I'm able to keep my arm straighter. So don't have your, I mean, you can at times, but generally speaking, don't try and rotate your arms in. There's no need for that. This, when you're bringing your thumbs down, you're going to cause catching, jamming, hinging, impingement basically of your tendons and ligaments, and it's not necessary. So try to have more your thumbs pointing forward, up, or behind you. Same with out, but this way. By doing so, you're allowing this in here in the shoulder girdle at the glenohumeral joint to be open instead of putting it in a compromised situation. So here, yes, it's okay obviously to hold on to the bar. You have to have your thumbs pointing in, just for the purpose of this stretch. It's fine. And this feels really good. Even if you only do this 10 seconds at a time, just make sure you're nice and centered and below the bar, and hang a nice deep breath. So one thing that's really good as well, then you can try and do lifting your body. So you still can touch the feet, your toes on the floor, and you use your muscle. Try not to use your leg. Your legs and feet are just there to kind of give you extra support, so you're not using 100% here of your body, lifting yourself up, but you're allowing this shoulder movement. So it's not great, 100%. I can feel the difference in my sits muscle, or which basically it's an acronym for all of the rotator cuff muscle, supraspinatus, infraspinatus, terri muscles, and subscapularis. So this is very good here, and you're basically lifting yourself up. So you're moving your shoulder blades. It's like doing this movement where you're bringing your shoulders down away from your neck, but you're doing it instead from below your lifting, okay? As opposed to lifting up your arms and bringing them down. All right, so that's for this one. That's a really good one, and it feels really nice on my hand with my carpal tunnel syndrome. I've had that ever since I was even much younger, in my 20s. I don't know if it kind of flared up after I had my son or somewhere around that time, but my brother has had carpal tunnel surgery. My mother has had surgery too. I've never had it. Instead, I just keep getting therapy, and I just watch what I do. Certain things I want to attempt doing, even though I'd love to, but I just don't, because I know my body would go and flare up. And I used to have thoracic outlet syndrome, so I need to really watch. All those things are much better, and obviously that's because I put a lot of work into it. Alrighty, so now we're gonna go sideline. So I'm gonna put my right arm up on the bar, and my body is right lining up below. The side that I have my arm up, I'm gonna have that leg behind me, And basically I'm gonna stretch the whole side here. So I'm really, my right side is lined up underneath the bar, okay? My left side is just a bit over to the left of the bar. I'm letting my body sink down to stretch all of that. And then I'm gonna push slowly, keeping my hips square, my back flat as much as possible, and tucking my bum, my glute muscles in a pelvic tilt, but nothing crazy, just a little bit to engage my tummy muscle. And I'm gonna push my right hip to the right, and that's about it. You can rest your head to the side just to enhance that movement of this opening, and that's all it takes. You could have this leg more, then you can move your back leg, which is the same leg as the arm that's hanging the bar, and you're gonna move this arm if you feel comfortable to make that step without the shoulder being in trouble if you do have an issue. And you're going to cross, so that now my right foot of the right arm that's hanging on the bar, from the bar, is past my left thigh, and that's gonna give you a further stretch. That's gonna even go into a bit of stretching your IT band, iliotibial band. So now I went away from there this way, where now I'm standing completely off side to the bar on the left, or from here to get out of that position I could bring my leg back underneath the bar and then just stand straight. So it's really stretching in here. It's good. It hurts. It's a good hurt at the same time, and it's but actually what it's doing, because it's stretching the fascia, stretching, flossing the nerves, as we do different flossing techniques, which we need to incorporate eventually. That's gonna help with the blood flow. So that's one of my goals. I hope it's gonna help all of that pooling of the blood that I get, that's showing redness, that eventually it's gonna dissipate. So now we're gonna do the other side, so same thing. So here I'm gonna have my left leg behind, because I have my left arm up on the bar, and already here by having my leg behind and stretching back, because I have my back leg is actually against the door frame back here, which is okay. That's something you could do too. And then just let your body hang like this. And this side of me is tighter anyway. And I do have lots of calcium buildup in my spine from when I was a teenager with gymnastics that I did, whether it's something genetic. I think it could be also genetic. It's in my family as well. It's been documented. So I don't want to blame it all on the gymnastics, but I'm sure it didn't help. So yes, when I was a young mother, I had to have x-rays, and it showed calcium buildup in my lumbar. I'm not sure how far up did we went, if we went to the thoracic. So here, there we go. I'm going to now move that back leg over past my right leg, and then we're gonna go further into a stretch and let my left hip go to the left. So that's stretching here, but it's stretching all the way into here. I'm bringing my left leg back behind me, and actually I have the heel on the door frame, which is good to give me support. And that's all there is to it. So it's really quick. Here I'm going slow and talking you with the descriptions and different scenarios, but this is really very quick. So I'm gonna step away from the camera for a second, and I'm gonna do this little demo like if I was doing it for myself without all of this comment, so that you really can see how quick this is. There's lots to do besides this, but those let's say there's one where you just hang, the one where you add this movement, this one here and this one here, that can be done in a few minutes. So I'll be right back. Okay, that was 8. Stretching the hand here. Now I'm gonna turn to the side. My body's below the bar. I'm gonna move my leg, back leg, crossing and stretching over to the side, letting the other arm there. Relax. You could put your leg behind, like against the wall of the door frame as well, and cross that way and stretch. Drop your shoulder down on the left side. I'm working the right side. And keep your head neutral, so it's tilted to the side, but yet it's neutral. So it's my left ear going toward my left shoulder. Nice little tuck in with my belly. And come out of that. And switch. My left leg is behind me as I am working the left arm now. I can go across and let my hip fall to the left side, toward the left, stretching all through here into the arm, all the way to my hands, hand and fingers, and stretching in here, and relax the back leg. Right arm can be to the side, and I'm going to flex. It's a lateral flexion of the neck to the right. So right ear to left shoulder, dropping my right shoulder, dropping my right ear to the right shoulder, and relaxing my shoulder down as much as possible. And as you breathe out, you should feel a nice relaxing of the tissue here, and then come up. So that's really all you need to do. At first, if your back feels a bit tight and like achy, like it's gonna give out on you from having on the side a stretch, then go back into this position, have your body right below, and just hang here. Tuck that belly, so see my hips are doing this movement, or like this. Yes, I'm doing this movement, and I'm gonna let my body hang just to get a little movement that could have happened in my back to loosen up. If you feel a little bit catching here, then instead of being closer with your arms, with your hands, and widen, and just hold as at whatever level you can. If it's too hot, stay up here. Use more of your legs up here, but it's gonna stretch your shoulder at whatever degree it needs. If you are recovering or in the process of recovering from frozen shoulder, even frozen elbow, issue with your wrist. I have an issue with my wrist always, and this is helping a lot. So that's pretty much it. And if you want to add a little bit more of this one again, so it's almost like you're going to do a chin up, but you're not. You're just working those shoulder blades. Using those, I'm lifting myself from the shoulder. I'm not really using my leg actively engaging. They're just there secondly to support, but I'm using my shoulders, and you're gonna feel that one shoulder is gonna behave differently than the other. One is when you lift, even if you're trying to lift together, one is gonna engage, certain muscles are gonna engage before once on one side than the other. You just try and relax by pulling those shoulder blades down slowly. So here I'm pulling down as your arms are up. So here my shoulders stay down, and that's what I keep doing. I'm pulling them down, and then lifting my body up and down. So here, as I let go as much as I can, here I'm higher up, lifting my scapular bones up through the muscles. Don't bring your head back. Keep your head nice and neutral. Ears between your arms, and chin neutral down. So if you have a point in front, your eyes are at horizontal level with it. And then down. And when you go down, breathe out and let the body the arm stretch as much as possible, even in through the chest here and thoracic. You want to relax and elongate all these tissues. So I hope you got some value from this video. Give me some feedback. I really enjoy it as much as there's some pain associated with it. I know it's helping me. It's a good pain if it can make sense to you. You see my hands are pretty red from it, but it's made a huge difference. It really doesn't take long, a couple of minutes, even if you only have 30 seconds and you can just do this one. Do it for 10, 20, 30 seconds. It's better than not doing anything. And in the process, it's gonna make you feel a lot healthier. So much more to do with this chin-up bar. But this is what I wanted to show you today. So get started, get moving, get healthy. This chin-up bar has many purposes we're gonna be doing over the month to come, and as winter starts setting in. Stay tuned for more. I hope you enjoyed this. Give me some feedback, and I am so looking forward to hearing from you. Thank you for watching, and namaste.
Cold like 0 degrees. I'm out the cage, gotta let out the beast. Revolutionary, gotta let out the streets. Locked in the cage, I'ma let out the wake up, get out the sheets. We came from one man, forget that peace. You take the west side, take on the east. I'ma put them in the cage, never let out the I hear them chatting the noise, move too quick, can't stop for the talking. I hear them chat with the boys, man so tough, but man's keep rocking. Just too sharp with the prize, white girls let her tell me I'm awesome, yeah. Hot like fire on the pine, if you wanna touch me, please use caution, 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 caution.